with the organs. Let's start with this big old gray thing, the liver. This is the left lateral, left medial, right lateral. It's a double-headed one underneath. And then the caudate lobe of the liver. So it has 5 lobes, and there is the caudate lobe right there. Now the gallbladder is also found in the liver. You'll find it in the right medial portion. So I'm going to separate this and poke right in there. And the gallbladder is going to be like deep in there. It's like a little balloon structure. Moving on, we have the stomach. Okay, cool. The stomach is composed of a few things. Here's the esophagus all the way down here. Then you have the fundus, which is up here. The body of the stomach. And inside the stomach, you'll find rugae. And then we have the, this is the greater curvature of the stomach. And you can also find the pylorus of the stomach right here. The pyloric junction. And so the pyloric junction connects to the duodenum, which is right here. And inside the intestines, you will find these little villi thing. This is not very well dissected, unfortunately. It's like these little finger-like projections. Okay, so here's the duodenum of the small intestine. You'll also find in the at the other end the ileum of the intestine. Now, one of the things we do on the test is we'll cut out an intestine. So you'll just see a stomach, a small intestine, and a large intestine sitting on a plate. And if we do that, one of the things we sometimes do is we'll take the middle of the intestine, which is known as the jejunum, we'll just put a pin right there. And so if I was going to test on the different portions of the intestine, I would test on the ileum right here where it connects to the large intestine, the duodenum right here where it connects to the stomach, and the jejunum all the way in the center. Well, we're not done yet. What about the pancreas? The pancreas has 2 lobes, the gastric lobe and the duodenal lobe, which you'll find the posterior pancreatico-duodenal artery and vein inside. We'll get to that in just a moment. Let's talk about the large intestine. Oh, I also almost forgot. This little gray structure next to the pancreas is the spleen. Okay, let's talk about the large intestine. So if we cut this out and we put it on the test, you'll see it like this, sort of, where you'll have, where you'll have a ascending, transverse, and descending colon. Cool. That's how it would look. And watch out, there's also the cecum up here. The cecum is used more in cellulose degradation, so you'll see it a lot in ruminants and other things that eat a lot of plants. Let's talk about the urogenital system. The kidney is right here. Now, on the outside of the kidney, you'll find the renal capsule. And this part of the kidney right here, where everything connects, including the ureter, which is right here, that's the renal hilus. On the inside of the kidney, I chose the wrong kidney for this. You're going to find the renal cortex, the renal medulla, and the renal papilla right here. Underneath the papilla, you're going to find the portion at the center that everything connects into. That's going to be called the renal pelvis. All right, so there's the ureter, comes down here and connects to the bladder. Now this is a female, so you're going to see female anatomy. Here, this big old circular structure that is not very well dissected. Let's see if it's dissected on the other side. Big old circular structure. There it is. This is the ovary, and it's connected to an oviduct. And then this is the uterine horn, also known as the uterine cornu. Comes down here to the body of the uterus, which is right here. It's a triangular structure. And then the vagina is down here next to the urethra. All right, that's all the organs of the lower body except for the male dissection, which I don't have with me right now. Let's get to some blood vessels. Now, the blood vessels are kind of difficult, so we're going to go through the arteries first. But just know that there are some blood vessels here where they have both arteries and veins in similar places. Let me get the hugs up for you. So the first thing to come off the dorsal aorta is this guy, the celiac trunk. Okay, the celiac trunk branches into the hugs, the hepatic, the gastric, and the splenic. Here we have the hepatic. It's all the way down here, and usually it's hard to find because it's going up towards the body into the liver. Then we have the gastric, which goes up into the stomach, and the splenic, which goes up here into the spleen. The next thing to come off is going to be the superior mesenteric, but we're going to get to that when we go into the intestines, which is a whole different ballgame. The abdominal aorta is what they're all coming off of. It's this big red thing. You're also going to find all the way up here, next to this thing, oh, I forgot, the adrenal gland. It's going to be the adrenal lumbar artery and vein. And then you're going to have this one, which is the testicular artery. And kind of weird, the testicular vein comes off of the renal vein. The renal artery is right next to this area, but it doesn't inject very well most of the time. So the genital artery and vein, it's very important that this is a female cat. So this is not the genital artery and vein. This is the ovarian artery and vein. You must be very specific if you want full credit on this. On the other side, you'll see that the ovarian artery and vein come off in a little bit different. So the ovarian vein will come off of the inferior vena cava, and the ovarian artery will come off right next to it. That's kind of different on the other side. Moving on, let's get a little further. Here is the iliolumbar artery and vein, and you must know that there is a correction in the book where there's for some reason 2 adrenal lumbar arteries. Okay, this is the iliolumbar. You should know it. Okay. Coming off at the end of the abdominal aorta, you're going to have this one, the external iliac, and the internal iliac, and the caudal, also known as the median sacral, also known as the what is it? Median sacral, caudal, and hypogastric. That's it. Okay, when the external iliac artery comes out of the body wall, you're going to have the femoral, and then up here you're going to have the popliteal, and then down here you're going to have the saphenous. Okay, let's do the veins in this area real quick. So we already know, here's the adrenal lumbar vein, this is the posterior vena cava, this is the renal vein, this is the iliolumbar vein, and down here, where all of the iliacs are, that's where things get a little more complicated. So the iliac veins go for this one. This is a common iliac, and then it branches into the internal iliac, which is, let's look at the other side. There it is. So it starts off as common iliac, branches into the internal iliac, and the external iliac, which of course becomes the femoral out here, and of course the popliteal and the saphenous. Okay, now, this is the hard part, because the intestines are kind of wiggy, and it's really hard. They're all over the place, and they go everywhere, and it's really hard to deal with them. But I'm going to do this as well as I can so that you guys can see what we're doing. So we have to separate this into the small intestine and large intestine, because there's different arteries and veins that go to either one. But starting off, we're going to do the arteries first, and the artery that comes off the abdominal aorta is the superior mesenteric. On the bottom, you will often find the inferior mesenteric, which is down here. Now, the inferior mesenteric comes up here into the large intestine, whereas the superior mesenteric services all of these intestines up here. And up here in this area, this is going to be mesenteric arteries, whereas on the intestines themselves, they're going to be intestinal arteries. It goes the same way for the veins, mesenteric veins and intestinal veins. Now, the superior mesenteric also branches into this guy. So see here, there's the superior mesenteric there, and it branches up here into the posterior pancreaticoduodenal. The vein does the same thing. Now, let's go back down to the large intestine. This is sort of cut, and I'm very sorry about that, but this would be the left colic right here. The middle colic would sort of be this one that connects up here. And then we have the really tough one, the right colic and the ileocolic. Now, the way you know this is the right colic is on one side of the cecum and the left colic is on the other side. So in order to understand this, we have to know that the right colic only comes onto the colon. So you see this one right here that's only on the colon? On the other side, you're going to have the ileocolic, which comes up here onto the colon, but also has a branch down here that goes onto the ileum. And let me see if I can uncover that. There it is. See that red one right there that's going onto the ileum? That's how you know that's the ileocolic. It comes up here into this area, which has been unfortunately cut really badly. Okay, we're almost done. That was all the arteries of the intestines. Now we got to do the veins. Now the veins, there is no left, right, or middle colic or on the veins. There is just a inferior mesenteric, which is where the left colic would normally be, an ileocolic, which comes up here into where the ileocolic and the right colic would normally be. And then, of course, you have all of these mesenterics and intestinals come up here So the inferior mesenteric, and they all get together with the posterior pancreatico-duodenal right here. They all get together to become this guy right here, the superior mesenteric. And at this point, you're going to find this little branch right here, which is not on your test really, but I show it to everyone because it's super easy. The gastrosplenic vein, and then all the way at the top where it connects with the liver is the hepatic portal vein. And that is everything you need to know about the cat except for the male dissection.